Let's talk about some of the cons when it comes to drugs like Ozempic and Mounjaro. I always tell my patients, if you are going to go on a medicine, you need to understand what are the benefits, what are the risks. If the benefit-risk ratio is very similar, that's not a good drug. Number one, if you have a history of constipation, that constipation can get significantly worse. If you have a history of irritable bowel syndrome, you may get loose stools, diarrhea, or worsening of your constipation. If you have a history of gallstones, you don't want to be on this drug because this drug can actually induce the risk of gallstones. If you had a history of pancreatitis, inflammation of the pancreas, for many other reasons, you don't want to go on this drug because this drug has an increased risk of pancreatic inflammation. This drug you need to monitor very carefully, especially if you don't have very good renal function. Therefore, you must talk to your doctor about your renal function. If you have a history of a lot of nausea, GI upset, disturbance, may not be the right drug because it will make it worse for you. So very important you talk to your